Good morning, and welcome to the National Academy of Science. My name is Patrick Kelley. I direct the Board on Global Health at the Institute of Medicine. This is the unit that, in partnership with the Board on Children, Youth, and Families, conducted this second evaluation of the President's Emergency Plan for AIDS Relief. I'd like to thank you for attending this morning. We'll be having a short briefing on the report by selected members of the committee, and that will be followed by question and answer. We'll also be taking questions not only from those present here in the auditorium, but also from those participating in the online webcast. This has been an exciting and truly monumental undertaking for the Institute of Medicine. As many of you know, this is the second evaluation of PEPFAR that we have conducted. We released in 2007 an evaluation of the first 5 years of the program. As you know, that evaluation was focused on the implementation of an emergency response to HIV/AIDS. This evaluation, in contrast, is focused more on the transition to sustainability and on the impact of the investments made by the United States. I'm happy to note that in the first evaluation, PEPFAR was described as a learning organization, and it has continued to learn. It's a very dynamic activity, and some of the conclusions and recommendations that you will hear about this morning are already reflected in programming that PEPFAR has instituted in recent months. The scope of this second evaluation was determined by specific verbiage in the legislation that was passed in 2008. We conducted this second evaluation in 2 phases. The first phase involved a 20-person committee chaired by Professor Bob Black to develop the plan for the evaluation following the guidance that was in the legislation. Following the completion and review of that plan by people at the State Department and on Capitol Hill, we reformed a committee with some new members, but still led by Professor Black, to actually implement our evaluation plan. That new committee was composed of actually 20 people. It was a very diverse committee reflecting expertise in the prevention, treatment, and care of HIV, in gender issues, in statistics, in social sciences, demography. We included not only people from the United States, but a number of committee members from HIV-affected, heavily affected countries in developing parts of the world. The committee conducted over 400 semi-structured interviews, visited 13 countries in South America, Africa, Asia. It collected an immense amount of data, probably an unprecedented amount of data, on clinical indicators, on financial flows, on other types of background information. It has produced this tome, approximately 700 pages in length. Obviously, you'll not be able to grasp the full richness of this report in the next hour, and so I would like to emphasize that members of the committee will be available to meet with interested stakeholders to drill down on some of the particular areas that were covered in the report. I'd now like to introduce the president of the Institute of Medicine, Dr. Harvey Feinberg. Dr. Feinberg has been at the Institute of Medicine almost 11 years right now and has been a tremendous support to global health as well as to this particular project.